More than a dozen people who may have been exposed to the deadly hantavirus are now quarantining in Omaha. Now, the 16 passengers were on board an Atlantic Ocean cruise. That's with confirmed cases of the virus. More than 100 passengers quarantined on the ship docked in Spain this weekend. All of the passengers are being monitored and are in the process of being returned to their home countries. 16 arrived at the University of Nebraska this morning. They are being quarantined in a special biocontainment unit on campus. They could remain in quarantine for 40 days, the incubation period for the hantavirus. Doctors say it'll be more comfortable than the ship they just left.
It is not a patient care space. It is much more like a hotel than a patient care space. We don't have the typical things that you'd see in a hospital room. It's a much more comfortable environment, actually, with some things to help keep people comfortable, like exercise equipment, and it's a larger space, TVs and things like that.
Now, the Nebraska facility also treated some of the first COVID patients in 2020.
Yeah, we remember when that happened. This time, doctors aren't as concerned about a possible pandemic. WHO 13's Lindsay Burrell checked in with the experts earlier today. Lindsay, what did they tell you?
Health officials say the current risk of hantavirus spreading to Iowa is very low, and that this is not the next COVID-19, as the diseases are vastly different, especially when it comes to contagion.
COVID-19 virus is a pretty different virus in terms of it is very contagious, in that one person has the ability to infect many. Hantavirus is not like that. One person who has the infection can infect those very, very close proximity and for a prolonged period of time, but it is not anywhere near contagious.
The Iowa Department of Health and Human Services says they're working closely with state and federal officials from the CDC, including Nebraska, to better understand the hantavirus patient's risk assessment. Experts with the department say that HHS has a disease surveillance system in place for all infectious diseases, connecting individual practitioners and healthcare providers, allowing them to report primary diseases. And while the disease is typically transmitted from rodents to people, experts say that's not necessarily the case right now.
Traditional hantavirus is spread from rodent excreta, that is aerosolized, and we can either breathe in or get exposed in that nature. This particular virus is a different strain than we traditionally see in the United States. It is one of the Andes strain of virus, of hantavirus. And we know that this is one of the few, of the hantavirus that is spread person to person as far as its transmission. And so, again, not necessarily from rodents specifically in this case. I mean, yes, it is, but it's also from person to person transmission as well, which is a little bit increased in this particular situation on this cruise ship. Okay.
Dr. Cruz says it's important that anyone experiencing a rodent infestation handle that situation for both hantavirus and just cleanliness overall. Symptoms of hantavirus are non-specific, so think nausea, fever, headaches. While experts understand it's our human nature to be nervous, especially given what we saw with COVID-19, they stress the transition dynamics surrounding hantavirus are very different, but do say that the next 72 hours are critical for reducing transmission, as we see this happening now with the quarantines currently in place, Andy.
Okay, is enough to make some skin crawl.
Yes.
Out there, I think right now. Thank you, Lindsay.